So let's talk about celiac. I am really excited to get into this topic because I feel like everybody I know is avoiding gluten or they're afraid of gluten. And I want to set the record straight for how unhealthy gluten is and what celiac is. So, first, tell me, is a lot of what you do taking care of patients with celiac, or is that just the patients that I have that I happen to send to you?
No, I have quite a few patients who have celiac disease. It's very underdiagnosed, so there's a lot of patients out there who don't know they have celiac disease. It's quite common.
How common is it exactly?
In non-Hispanic white people, it's about 1%, which to me is very high, but only about 1 in 3,000 are diagnosed. In Hispanic people, it's 0.3% roughly, and in black people, 0.2%. So it's more of a white people, non-Hispanic disease, but anyone can get the disease.
Interesting. So that sounds like quite a few people are not diagnosed. If you're saying 1 in 3,000 are diagnosed, but about 1 in 100 actually have the illness, that's quite a
Yes,
number that don't realize they have the disease.
yes, absolutely. And patients can go years without diagnosis who are having symptoms.
So, what is celiac exactly? Can we start with a definition of what celiac is?
It's an autoimmune disease. It is not a food allergy. So over time, people who have celiac disease, their immune system is overactive. So when they eat gluten, not at that moment, but over time, it attacks their intestine. It causes atrophy of their intestine so they do not absorb nutrients appropriately.
And what are the symptoms that people might expect to find if they have celiac?
Well, when they're symptomatic, that makes it a little easier to diagnose. In a toddler, it would be not gaining weight, chronic diarrhea, and a distended belly. It could be in an older person or an older child. Could be fatigue, could be headaches, could be constipation, vomiting. There are so many ways it could present. There's also those patients who have no symptoms that we can diagnose, but that's usually when we screen family members of known patients with celiac disease.
That's so interesting. I can see now why many cases are missed because so many of these symptoms are vague. I can see why many people may continue on and not see a doctor.
They are very vague, and even a child with short stature who has no other symptoms may have celiac disease.
That is interesting. So, if somebody is suspicious that their child has celiac, what would the next step be?
They should absolutely have a blood test to screen for the disease as a first step.
Interesting. Okay. So, I guess why I ask is I meet a lot of people that they're afraid to go to the doctor. They don't want to get a blood test. They don't want to get a workup. And they'll ask, well, why can't we just take gluten out of the diet and see if symptoms improve? Do you think that is a reasonable approach? And if not, why not?
That's a great question. It is not a good approach because it's a lifelong diagnosis unless a cure comes up one day. But if you have celiac disease, you need to avoid gluten for your entire life, which is a great burden both financially, socially, and sometimes psychologically, especially for a child. So you want to make a definitive diagnosis.
Okay. Yeah. And I also think that gluten has, I don't know if fairly or unfairly, but seems to have a bad reputation these days. But I do feel like there are many foods with gluten that seem to offer nutritional value. Would you agree with that?
Yes, and some of the gluten-free foods, or a lot of them, unfortunately, are high in sugar content in order to make them more palatable. So therefore, gluten-free isn't always the healthiest diet when looking at that aspect of it.
There's a coffee shop I go to regularly, and most of the baked goods they offer are gluten free. and they're presented in a way as if it's healthier. And it doesn't make sense to me that a baked good modified could be healthy in some way.
Correct. So it helps our patients who have celiac disease that other people want to be gluten-free because it encourages the market to produce more products, for at least for the patients who have celiac who absolutely need to be gluten-free.
Yes, no, I agree with that. I do have a good friend who has celiac, and her life is so much easier now having a gluten-free diet, now compared to when she was a child. There's so many more gluten-free options. But I think for the rest of us who don't have celiac, it doesn't seem to make a whole lot of sense. I'm curious what you think about that.
It doesn't. I don't think the general population needs to go gluten-free. And gluten means not just wheat, but rye and barley too.
Okay, so when you say gluten, you're talking about wheat, barley, and I know there's a lot of other foods that people don't suspect have gluten. What are those foods? Can you mention those secret foods that people don't suspect have gluten but do?
Well, oatmeal in a pure form is gluten-free, but unfortunately it's manufactured often in plants that have wheat in it, so one needs to buy gluten-free oatmeal or oats, which are manufactured separately in order to avoid contamination. But gluten is used as a filler in many foods, so unfortunately in foods you might not suspect it unless you read the label, it might be present. It's even present in lipstick, which may or may not be a problem. It's near your mouth, obviously. So cosmetic products may contain gluten. Also, it's a cheap filler.
Okay, so let's talk more about celiac and the symptoms. We talked about some of the symptoms that you might see with babies and older kids. Are there any other symptoms that parents should be aware of?
Migraine headaches may be a sign of celiac disease. If they suspect their child's not growing well, as we talked about earlier, they may not think about celiac disease because there's no gastrointestinal symptoms. If you're referred to an endocrinologist, they always screen for celiac disease when they're evaluating a patient with short stature. A lot of pediatricians, though, pick up celiac disease now because they're aware of it through platforms such as this, and they are screening for it, which is very helpful because not everyone sees an endocrinologist. So when the pediatricians pick up the patients, it's great because they can pick up all these undiagnosed patients. They're seeing them on a regular basis.
And when a pediatrician does a blood test looking for celiac, does that diagnose celiac?
No, if the test is positive, then they may have celiac disease. If the test is negative, it's very unlikely they have celiac disease. So it's just the beginning, but it's a wonderful screening test. So if a child has any gastrointestinal symptoms, you're drawing blood anyway, it's great to have your pediatrician send along a celiac panel too.
I agree with that completely. And there are a variety of blood tests that we can look for celiac. What is a specific blood test that you like to see for diagnosing celiac?
Well, a lot of the commercial labs have what they call celiac panels. So it's a group of antibodies. They vary from lab to lab, but the primary one we use is something called tissue transglutaminase immunoglobulin A, and that's the most sensitive one. There is another sensitive one called endomesial. However, that depends too much on the lab tech interpreting things as opposed to the tissue transglutaminase one, which is a machine-driven number.
Okay, so let's say it does come back positive for tissue transglutaminase, and there's a suspicion that a child has celiac. At that point, a child would then see a GI specialist like yourself, and then what would be the next steps? What would be the recommendations to treat celiac?
So we likely, unless the patient's very ill, would not want to start a gluten-free diet at that time. We'd want to do what's called an upper endoscopy with biopsies. I know a lot of parents are reluctant at times to do that because it is a procedure that involves anesthesia. But those 10 minutes that the procedure takes to do helps make a better plan, a more definitive plan for your child for the rest of their life. Because some patients with elevated celiac antibodies do not have celiac disease, and the biopsies come back normal, and over time, those antibodies may revert to normal. The reasons for that are not always clear, but we do see that from time to time. So those patients without doing the biopsy would have been gluten-free for the rest of their lives.
So that would be, as you mentioned earlier, it's a huge social burden, a huge cost burden. It would not be fair to put somebody on a gluten-free diet if they don't need to be.
Absolutely. And some things that a dietitian would explain to a family of celiac disease. For example, toasters are impossible to clean. So if your child who has celiac disease uses a toaster, they have to have their own toaster. They have to have their own cutting board, or you have to meticulously scrub the one that everyone in the household uses. So there's all these unexpected consequences of having celiac disease, which, and especially in an adolescent, creates psychological problems. Why do I have this? Why do I have to be different than everybody else? And it could lead to depression even in some cases.
I could see that. Absolutely. So, okay, so that makes sense. So I'm happy to hear you say that the procedure, while it is invasive, it's fairly reasonable. It's quick, 10 minutes. I like hearing that. I think that's very reassuring words from you. So while it is a procedure, you're saying it's not that bad.
Yes, it's done very often. The risk is minimal. The parents should really be concerned more about where is it being done and who's the anesthesiologist? Are they used to children? If you do it at a reasonable surgical center or a hospital outpatient facility in a large city, you shouldn't have any problems at all. But that's the question to ask. The GI part of it is quite simple. The anesthesia part actually is too, because usually it just involves an IV and something called propofol, which is a very safe anesthetic agent given intravenously. And once the procedure's over, it's all turned off. Your child wakes up a few minutes later and they go home within an hour. And except for going back to school, they don't need to lie in bed afterwards. They could go out and eat or whatever they want to do.
That's helpful to hear. And this procedure will give you your answer if they have celiac or not, correct?
Correct. That's at the 99% level.
Okay. That's pretty good. I'll take 99%.